Welcome to the Journal Club for this week. This is study titled The Prevalence of Painful Temporomandibular Disorder in an Endodontic Patient with Tooth Pain. It was done by Daline et al. And it was published in the Journal of Oral Rehabilitation in 2023. Temporomandibular disorder are the most common non-endodontic pain etiology in endodontic practice and the most common non-endodontic reason for persistent pain after root canal treatment, with a high percentage that reach 62. So this cross-sectional study is aimed to determine the prevalence of masticatory myofascial pain and TMG disorder in a patient seeking non-surgical root canal treatment. Also, to evaluate the contribution of temporomandibular disorder to the chief complaint and to assess the characteristic of the patient associated with the prevalence of temporomandibular disorder. For the participant inclusion criteria, any patient age 18 years and above and who has scheduled for an evaluation for initial non-surgical root canal treatment or retreatment for a permanent teeth with a history of pain within the last 30 days were included. On the other hand, they exclude any patient had odontogenic pain of non-odontogenic origin, any patient assigned for elective non-surgical root canal treatment, any patient who has endodontic treated teeth and within the last 30 days, any patient who has a history of trauma or surgery on the face and the head within the last 6 months, any patient with communication difficulties or severe psychological disorder also were excluded. The data of this study were collected by a single investigator. The investigator pre-screened the patient by phone and confirmed their eligibility. The eligible patient then assigned for a single visit before their appointment with the endodontist to sign a written consent and to complete a multiple questionnaire. The first one is the chief pain complaint questionnaire to assess pain location, onset, intensity, aggravating factors, symptoms. And the second one is the graded chronic pain scale that assess the TMD pain intensity and the interference with the daily activity. The third questionnaire is the patient health questionnaire that is a validated psychological questionnaire for the depression and the anxiety. The fourth one is the preserved stress scale that measure the level of stress. To assess whether the TMD contribute to the persisting pain, after they did temporomandibular disorder diagnosis with the diagnostic criteria and the muscle palpation, they classified that pain into 3 categories. If the TMD diagnosis did not replicate the patient's chief complaint, they consider this as unrelated. If the patient TMD diagnosis replicate the chief complaint and the endodontic evaluation shows pulpal or periapical pathosis, they classified this as a contributing factor. But if the TMD examination replicate the chief complaint, but there is no sign of pulpal or periapical pathosis, they consider this as a sole pain etiology. Coming to the result for this study, endodontic examination shows that 81% of the symptoms related to a molar teeth, 45% had a negative response to cold test, 75% were tender to percussion, 45% were positive to palpation, and 63% were positive to bite test. The most common pulpal diagnosis was pulp necrosis in 34%, and the most common periapical diagnosis was symptomatic apical periodontitis in 65%. In regard to the TMD pain prevalence and contributing to the chief complaint, from the 100 patients, 46% had only endodontic pain, 26% had both endodontic and TMD pain, which was unrelated to the patient's chief complaint. 20% had both endodontic and TMD pain that is contributing to the chief complaint, and 8% had a sole pain etiology. For the characteristic of TMD pain among the 54 participants who diagnosed with TMD, they had a mild to moderate pain intensity with a mean of 3.9, and 42% of them had a chronic facial pain. 48% of them had a TMD pain that's referred to intraoral structure. 55% of them had tooth pain before a jaw pain, while 30% had a jaw pain first, then a tooth pain. 13% had both the tooth and the jaw pain in the same time. To conclude, as this is the first study that assessed the prevalence of TMD using a validated diagnostic criteria for patients seeking endodontic treatment, it shows that the majority of those patients had a painful TMD, and in over of a quarter of the patient, the TMD either contributed to or a sole etiology to the chief complaint. Thank you.